And now at this time, I'm going to go ahead and present to you our first presenter, which is Ms. Dora Ramirez. She has a bachelor in psychology. She's been in the prevention intervention field for the past 16 years. She is a licensed chemical dependency counselor, and she's also a certified prevention specialist for the state of Texas. I want you to welcome Ms. Ramirez.
Can everybody hear me? Yes. Well, good evening. I'm happy to be here. And my information that I'm going to be presenting to you is on the youth alcohol, tobacco, and other drug surveys that were administered here in Webb County. This data was collected by the Webb County Community Coalition of Scanning. And this were administered to selected United Independent School District students and Laredo Independent School District students. And the information I'm going to be presenting to you is data for 4 years, for the last 4 years, 2008 to 2011. And this data, because this survey collects alcohol, tobacco, and other drugs, but for this presentation, I'm only going to be presenting on alcohol data. Okay? The basic demographic data on the students. For the past 10 years, the Webb County Community Coalition of Scanning has been yearly administering the alcohol surveys, or alcohol, tobacco, and other drug surveys to the selected middle and high school students. And for the past 4 years, we collect, the total amount of students was 7,696. My following, I apologize. I want you to keep this in mind as I do my presentation, because I'm hoping that I can get the message across. And the message is we need to start talking to them before they start drinking. So start talking before they start drinking. It's so important. Obviously, the video shows that we have a problem. Nationally, we know we have a problem. Webb County is no exception. Okay? We have a problem. And I'm going to show you data. This is individuals participating by school district. I mentioned that we have 2 school districts, UISD and LISD. And I'm going to give you percentages of how many were administered throughout the 4-year span. 73% of students participated in this survey at UISD, and 30% were from LISD, totaling the 7,696. And you might ask, why UISD had more students being surveyed? Well, because there's reasons. UISD has more schools that we can go into, and there's 2 types of consent forms that we administer before we can do a survey. We do the passive consent, which is what UISD uses, and the active consent, which LISD uses. So that's the reason that we're doing more surveys at this school district. Like I mentioned, all this data that I have here, all this graphs and information I'm going to be sharing with you, is what was part of the survey that was given to the students. And on this percent of students reporting alcohol use, the students were asked the following question. On how many occasions in your lifetime have you had an alcoholic beverage to drink more than just a sip? Okay, so think about it. Our students, which are middle and high school, we're asking the question, how many of you in your lifetime have had more alcoholic beverage to drink more than just a sip? And sadly to say, 47, almost 48% reported having already drank alcohol. And out of this same question, there's another question that follows. On how many occasions in your lifetime, if any, have you been drunk or very high from drinking alcoholic beverages? And our students reported 24% were already reporting that they were drunk. Regarding gender, who's drinking more? The data shows that boys drink more than girls. Okay? That's what the data shows. And I'm just reporting on the last 4 years. But sadly to say, in 2011, there was no difference in the boys and girls. They were both equally drinking. They were both reporting lifetime. So historically, we have that 50% of our kids are drinking alcohol. On this next slide, our students were asked, how old were you on the first time you had your drink of alcoholic beverage? They were asking this to our students. Think about it. Something is mind-boggling. And the average age is 12 years old, 12.77. And we're looking at 6th and 7th graders. And I want you to think that the legal age to drink alcohol is 21. Not 12, not 13, not 15. So there's a big gap in age. So we know that we need to start talking to our kids now. This is data that you all need to take home. If we need to talk to them now, not at 12 years old. We need to do it elementary. The minute they start knowing what is right and what is wrong. And we know that prevention, education, we can make a difference. But this is a community problem. This is a problem where we all live in. We need to do something. I talked to you about lifetime use. I talked to you about first-time use. Now I'm going to talk to you about 30-day alcohol use. Okay? Students were asking how many occasions during the last 30 days, just think about it, when they did the survey, had you had an alcoholic beverage to drink more than just a sip? 29% reported that they had done that while they were doing the survey within the 30 days. And then they were asked, on how many occasions during the past 30 days were you drunk or very high due to alcohol beverage? Within the 30 days, 13%. So, again, can be lifetime use within the 30 days. Regarding gender, boys drink more than girls. Boys get drunk more than boys. But in 2011, again, the data I'm telling you, girls drank significantly more than boys in the past 30 days. And why is this happening? Because wine coolers are so widely promoted, so glamorized. It's not alcohol. Well, let me tell you, wine coolers contain more alcohol than beer. 60% alcohol in wine coolers. Regarding the perceived risk of alcohol use, how do they feel? When they were asked, how much do you think people risk hurting themselves physically? Or in other ways, if they take 1 to 2 drinks of alcohol beverages nearly every day. And what was the reaction of the kids that the students gave? Well, 30%, 33%. Taking this risk says they feel that it's a great risk. And we're sending some messages. The reason that there's 33%, I have to throw it out to you. Alcohol is so socially portrayed. It's so socially accepted. In our community, we have many social events, many local events that promote alcohol. Many local events, many universities, the universities and colleges promote scholarship fundraising, dealing with alcohol as a fundraiser. We can do other things. So it's so socially accepted. Advertisers spend millions of dollars advertising to try to get you to buy their product. Celebrities endorse it. And of course, we keep sending a double message when we tell them, don't drink, but I'd rather you drink here than, and stay here. So we're sending a message. And so we also want to let you know that the message they think it's a great risk of regarding tobacco. Why? Because tobacco, we have a no smoking ordinance in place. No billboards are out there with the smoking signs. We have so much ingrained in our students about the dangers of secondhand smoke that they're saying that's a great risk, but alcohol, they don't feel it is such a great risk. Females rated daily alcohol use as significantly more risky than men. When they were asked about their attitudes toward alcohol use, they asked them, how wrong do you think someone your age to drink beer, alcohol regularly? What did they say? They said 46% reported they thought it was very wrong. So we know it's wrong. We're getting the message, but we need to do more of it. Okay? We need to create more awareness. We need to let them know about the benefits of them not starting. If the longer they delay the onset of alcohol, the more chances the students will not be drinking alcohol at the later years. 5% thought that regular alcohol use, and when I'm talking regular, I'm talking about daily. They thought it was fairly accepted, but there was nothing wrong with it. So we know we have a battle. We have a long way to go. But this is what we're all here to do. We're here to send the same message. Oh, right. And the gender difference was that in 2011, females rated someone their age drinking alcohol significantly more wrong than boys. You know, boys don't think there's a problem. This is some responses in reference to committing not to use alcohol. If they had a chance, and I knew that I would not I would get drunk, let me tell you, 27% said they were willing to take that chance. 27%, that's a lot of students. You know, they didn't care about getting caught if they were at that opportunity. 26% reported that they plan on getting drunk within the next year. And I want you to think about this one. I want you to think that when you hear your kids or your children, you know, that they're planning on going on spring break, who are they going with? Where are they going? What are they going to do? Are they just going to go drink some? You know, I really want to send a clear message. We need to talk to our students, like the children, and let them know that, first of all, it's legal for them to do it. So we're going to send a clear message to them. Out of this, their commitment to, they promised themselves they would not drink alcohol. Well, 61% said they promised themselves not to drink alcohol. So we're getting there, but we need to do more of it. On the question, when they asked them, how long do your parents feel it would be for you to drink alcohol regularly? 10% believe their parents, that the parents think it's nothing wrong with them drinking alcohol. And I want to say this. The attitude, the parental attitude has to start at home. Okay? They need to send clear messages to their children. What messages are the parents, caregivers giving to the kids? What are we telling them? You know, when we tell them, don't drink and drive to a 13-year-old. If you drink, stay with your friends. Stay at a friend's house to my 17-year-old. I'd rather you drink here at home than you go out there. What are messages are we sending? We need to start talking to them and sending them clear messages. We need to tell them 21 is 21, and you can only drink alcohol at 21 if you are to drink alcohol. You know, I'm not going to allow you to drink alcohol. You know, if you choose to drink, you need to do it when you're 21. So we need to really send this message. You know, the Surgeon General is telling us we need to have a clear expectation of what it is. And it says here, start talking before they start drinking. In a gender, females feel that the parents pursue their disapproving of alcohol on the females more than the males. The boys think it's okay. I'm not gonna say anything. My dad might have said anything. But they were asked about the availability of alcohol. If you wanted to get some alcohol, how easy would it be for you to get some? Guess what? 36% report that it's still easy to get. But we have 62% that are telling us, it's not easy at all. I'm still having some trouble. But this goes back to the effort of what we're working with. We're working with the Laredo Police Department, working with our local law enforcement to try to do the alcohol stick. This is working with the coalitions and saying, we need to do something. Let's come together and work together to prevent our kids from underage drinking. And of course, you know, the gender difference, males reported that it was easier for them to get alcohol, which is true. You know, boys tend to feel that alcohol is easier for them to access. The girls kind of, you know, we kind of think about it a little bit more. But boys, that's what they're reporting. And my summary and conclusion of this presentation, it's a lot of data that I gave you. It's a lot of data. But this is data coming from our students. And this is just 4 years of data. There's, like I said, we've been doing this ATOD surveys, alcohol tobacco surveys with our both school districts. And 50% of them report that they are reported using alcohol as a lifetime. The average age is 12.8, you know, when they first use alcohol. It's between 6th and 7th grade. Let's start talking to them sooner. 28% of them reported already have experimented with the music within the 30 days and then being drunk within the 30 days. That's way too many students. Only 32% rate risk of the alcohol. They consider the tobacco use to be a greater risk. Let's change it. Let's continue promoting that alcohol is as dangerous as tobacco. 46% of our students reported that they have a favorable attitude toward the regular use of alcohol and of the cigarettes, like I just mentioned. And their commitment. We want to make sure that they're committed to not getting alcohol. We want to make sure that they fear getting caught and they're not going to get drunk. Our students, 26 of them reported getting drunk in and the parents' attitudes. We want to make sure that our parents are sending the same clear message and that the alcohol is going to be very hard for them to get. So what can we do as a group? What can we do in the community? Well, first of all, we definitely need to talk to our children about the consequences of drinking alcohol. Don't provide food to anyone alcohol at home. Okay? Know the law. We're going to have someone tell us a little bit about the law. Don't go to parties where alcohol is going to be served. It's so important because if it's available, they're going to find a way to drink. Keep alcohol in a secure place in your homes. Lock it up. If you haven't locked it up, don't make it accessible to them because they can actually dilute it with water. And know the law. 21 means 21. You cannot be 19. You cannot be 20. The girl said they were 17. They were breaking the law. 21 is 21. And reporting underage drinking to the law enforcement and the last thing that I could tell you refer to an alcohol education program for minors. And on that note, that is my presentation. I will be here after the last presenter to answer any questions that I can on the data. And with that note, I'll pass it on to Ms. Gunn. Thank you very much for your
Okay, my name is Priscilla Camilo. Just going to give you a little background. I have a master's in sociology. I've been working in the prevention, intervention, treatment field for the past 16 years. I am a licensed chemical dependency counselor, certified prevention specialist, and I'm also a minor possession instructor. So I'm going to go ahead and tell you a little bit about the program that we have. The name of the program is the Alcohol Education Program for Minors, and it's the MIT program. The reason, just give you a little bit about why we got this program. The reason we got this program in the agency is because we're getting a lot of kids coming in through our doors and with citations that they were drinking, underage drinking. And at that time, which was 12 years ago, there wasn't any program locally where the kids can go and take that alcohol education program. They would always send them and they have to go to like San Antonio or somewhere else out of town. Mind you, a lot of these kids, our kids here from Laredo, would get citations out of town and have to come here home, and then we didn't have anything to offer them. So that's the reason why 12 years ago, which the program has 12 years in existence, was the reason why one of our administrators thought that it was a good benefit to our community. Approximately, I think up to date, approximately we served about 286 students, youth, that have gone through the program. 286. If you think about it, Joshua County, our population, I think it's about 200, 250. It is happening. There are kids that are getting cited, but they're just not getting funneled through. Or, their citation is taken away where they don't have to go through the class. But remember, there is the law, there is the code where it says that if you are cited for an MIT, it's a requirement for you to attend the class. I'm going to go ahead and tell you a little, the definition of a minor possession. Attempt to purchase. The attempt to purchase is the youth is actually in the store and going to the counter and trying to purchase the item, the beer in this case, the alcohol. And obviously either the vendor did sell it or they had some type of fake ID. And then the purchase, they actually went through the process, they purchased the alcohol, or they just had it in their possession. It was around them, they had it in their hand, possession of it. The consumption, obviously they were drinking it. And remember, as per the law, if you just have it, if say their friend or whoever they're with just spills a little bit on their clothes, that's possession. I mean, it's any detectable amount. And, of course, misrepresentation of age. If you went to a place and said, you know, I'm 21, and they didn't actually check them, or they had a fake ID. The penalties for MIP, there are 5 penalties. One of them is a fine. The second one is community service, loss of driver's license, and the education. The reason that I highlighted it is because it's the most important. And it's the one that is required on their first citation. But the years that I've been teaching the class, there's a lot of students that have asked for class and said, you know, I was caught with like 4 or 5, a group of 4 or 5 kids. Why am I the only one? So that's something that we need to think about with our kids. You know, they're out there, they're drinking, they're having fun, but they're drinking at the same time. They're legally drinking, and they're going through a lot of changes in this time before they reach 21. So they're experimenting with a lot, and they're taking a lot of risky, you know, decision making. Alcohol education program for minors, MIT program. This is the actual code in the Texas Alcoholic Beverage Code, where it also says about purchase, the possession, the consumption of alcohol beverages to attend an alcohol education course, and also an addition of fine. We always hear it from all the kids and and when we have our classes, you know, oh, I didn't have to pay the fine, or I paid the fine, but I didn't have to go to the class. You know, remember, you know, it doesn't hurt for the kids to go to a class. And I'm telling you that because a lot of the kids say it. You know, my parents got me out of it. My parents said, no, I don't have to go to it. So they talked to a judge. It doesn't hurt them, it'll only help them to increase their knowledge on everything and anything that can happen. The class is 6 hours in length, 2-day, 6-hour class. Each day is 3 hours. The topics of it is societal values related to alcohol consumption by minors. This is talking about how the society view drinking, the word drink. We use it so loosely, like saying, you know, let's have a drink. Let's go have a drink. You know, she has a drinking problem. You know, things like that. And our kids are hearing us when, and I'm saying us because we're the adults. We're the ones, we're supposed to be the role models. How we talk to our kids, how we express ourselves in front of them, that's something that we need to check and observe ourselves and say, you know, like Ms. Ramirez said, we need to start talking to them. And if we're going to start talking to them, we need to be able to talk to them in a way that they'll understand. Because sometimes we think that, you know, they understand what I'm saying. And really, they don't. They don't. If we don't talk to them and their way of understanding things. And I'm telling you that because a lot of kids in the class, when they come, they say it's the same thing. My parent doesn't understand me. I tell them this, I tell them that, and they don't understand what I'm going through. And they say, one of my parents said, I've already done what you've gone through. You'll be okay. Those are some of the comments. The next one is the influence of alcohol advertising on young people. Our media is so powerful that our kids, you know, even us as adults, you know, how many commercials do we see on the TV and we actually go and buy the product just to see if it actually works? The same thing with kids. You know, media glamorizes everything. Glamorizes, you know, that if you drink, you're going to be part of the crowd. If you drink, you know, you're going to be that nice guy that looks really good and cool. You know, so the media is something that is really affecting our youth. You know, media is not very, it is hard to keep away from, but just as long as you talk to your kids and let them know and understand, you know, the message that the media is trying to tell them, you'll be okay. Or your kids will be okay. The next one is the physical, the social, the psychological effects of alcohol upon young people. During the class, we also talk to them about how it affects their body, how it affects their social peers, how it affects, you know, when they're among their peers, how it affects their brain and their decision making. Also, the relationship between motor vehicle and other accidents and alcohol use. Remember, a lot of these kids are, one, drinking, and two, getting behind a wheel. Or going with a friend who supposedly was not supposed to drink or is of adult age and get into an accident. Or any situation. But remember, the number one thing is that, you know, we need to educate, as Madam was stressing, we need to educate our kids about underage drinking. It is illegal for them, and it is dangerous. Other accidents that can happen is like, kids love to go swimming during the summer. Everybody does. It's hot, especially here in Laredo. And there's a lot of risky things that a lot of kids do, which is one, jump off the highest roof that they can see. Falls, fires, any other accidents. But why? Because they've been drinking. Relevant laws relating to the purchase, possession, and consumption of alcohol beverages by minors. Like I said before, minors try to get the minor possession. It is illegal to try to purchase it, and to possess it. But our kids are still doing it. They still are. This is drinking problems with young people, including abuse, addiction, and decision-making skills. During this time, we teach them the stages of addiction. There's four of them. And some of the kids always say, you know, I do that, and I don't feel like that, or you know, I have a family member that I've been drinking for the longest time, and they're not like that. You know? Why me? Does that mean I'm addicted? You know, they have a lot of questions, a lot. You know, and sometimes we feel that we're showing our kids everything that we can, and yes, we are. And we know that we're not going to be with them 24 hours a day, but that's reality. They are drinking. And I'm going to let you know, like I said before, some of the comments that they say. I frequently go to parties at other people's houses where there are adults present. These are comments that the students make. Is it true that as long as any adult is with me at a club or party, I can drink? By law, if you're the parent or the legal guardian, yes, you can. But what is the message that we're giving them? My parent lets me drink as long as I am with them, just like Ms. Ramírez mentioned a while ago. It wasn't even mine, I was only carrying it. All students have assumed that whiskey is more potent than a bottle of wine cooler. When we show them this slide during the class about the differences in alcohol content, the students are like, their eyes increase, they get larger, because they're like, wine cooler, that doesn't have as much alcohol. Beer does, or whiskey. But remember the size of the glasses? You remember the video, as the lady said about, you know, what her son drank? Shots? That wasn't a shot. That was a 4-ounce glass. And he drank 21. So there's a difference between your meaning of a shot glass and our youth meaning of a shot glass. I usually get my alcohol from an adult family member. The message here is that a lot of youth or minors, kids, they have an adult member or adult person in their lives that either purchases the alcohol for them or makes it available. And that's what we need to focus on. We need to focus on the education efforts of underage drinking, looking into our way of doing things. You know, our kids are our kids. We don't want, we don't want anything to happen to them. But yes, these are the comments that they make. Just a little information about the course registration for the program. The course fee is $35, and it is a 2-day, 6-hour program. We do have a voluntary participation. If you think that your child your child will benefit from this program, but if you think that they can take it as a preventive or an educational measure, send them. They don't have to get to the point of getting a citation. They can go to the class and increase their knowledge about underage drinking. And they also will receive a certificate of completion. This is our 19th schedule for the 2012 year. As I speak, there's a class going on, being conducted at our agency. Before I came, I spoke to the instructor, and there were 7, 8 students. And I asked her, of the 7 students, where did they get their citation? And of course, like I said before, they all but one, got it during spring break at South Laredo. People go, the youth go, not only college people underage youth, they go with their brothers or sisters, they're going to the beach. But beach for them is beach and drinking. And as I said before, the majority of the citations are from out of town, because they're going out of town to do just that. There's information on the agency for staff. There's a phone number, there's an email. I just want to leave you with a message that, we don't want to get to the point where none of us want to be in the position of you get that call or you get that knock on the door at 3 o'clock in the morning, 4 o'clock in the morning saying your son or daughter was in an accident and they were drinking. Thank you. Next, I want to introduce Ms. Saldana. She's going to be talking to you. Ms. Saldana, she has a Bachelor in Fine Arts. She has been in the prevention intervention field for the past 11 years. She is a program director at SCAN, and she is a certified prevention specialist for the state of Texas. I want you to welcome Ms. Saldana.
Good afternoon, thank you. I'm going to go ahead and talk to you about the Surgeon General Call to Action to Prevent and Reduce Underage Drinking that was released in 2007. This is by the U.S. Department of Health and Human Services. We know that underage drinking is not a minor problem. And the purpose of this call to action is really to engage all levels of government as well as individuals, private sector institutions and organizations in a coordinated, multifaceted effort to prevent and reduce underage drinking and its adverse consequences. The information that I'm going to present to you is based on best practices, which means that they've been proven to be successful. So we've been working on this for many, many years. We know that underage drinking is a persistent and prevalent problem But the good news is that we have some strategies that can be put in place in our community to prevent this from happening. So what is the nature of underage drinking? We already talked tonight about the age of first use being 12 years old. So we need to start picturing how young these kids are. They're middle schoolers. So we know that alcohol is the most commonly used substance by youth. We also know that people begin drinking at a very young age, which means that by the time parents are engaging in conversations with their children, they're 2 years behind the game. So we also know that youth tend to drink less frequently than adults, but when they do, they tend to drink in a shorter amount of time and more heavily. And boys again tend to start earlier and drink more than girls. However, as Juanita mentioned, this trend is changing. And we also need to keep in mind that the ladies, the girls, metabolize their alcohol differently, so they'll get drunk faster with less alcohol. So some of the adverse consequences of underage drinking, I have here a quote from parents that really, I guess, clearly pictures all the consequences, short-term and long-term, of alcohol use. All of those things that you would absolutely not wish happened to your child can stem from underage drinking. So of course there are short-term and long-term consequences that not only affect the youth and their family, but affect everybody around them and the nation as a whole. So what's mostly covered by the media and what we hear most is motor vehicle accidents. But of course, alcohol use also is related to violence, to unintentional injuries. We've heard of youth jumping from a second floor, because they've been drunk, falling from a staircase. Boat accidents, we don't hear about those a lot. We have a lake, people have drowned, you have unintentional injuries covers the last type of injuries. And if you think about it, they're at their prime between the 12 and 20 years of age. They're priming their health. And most of the people that go to the emergency rooms are either through, at that age, are because of motor vehicle accidents or unintentional injuries. Another one that's really important is how they can engage in risky sexual behavior. That could be unintended contact, having multiple partners, that of course can lead to STDs, HIV, unwanted pregnancies. And if the ladies are drinking, they also have the risk of having a child with FASD, which is fetal alcohol spectrum disorders. And least commonly heard of is homicide and suicide, but it's part of the statistics also. So of course, some of the first signs that we might see is academic failure, and also alcohol can lead to the use of tobacco and other illicit drugs. And of course, early onset of drinking can be a marker for future substance abuse disorders. And it can be as short-term as a hangover and as long, it can lead to death from alcohol poisoning. And one thing that I want to point there is that a lot of times youth are drinking behind their parents' back. They're drinking a lot in a short period of time. So if there's any situation of alcohol poisoning, sometimes they don't know what to do. They panic, they don't call 911, they leave the scene, they leave the person there, or they don't take appropriate action. So that's another thing that we need to educate our youth about. And part of this call to action also focuses on the fact that recent research shows that alcohol use affects brain function and development. So if you think about it, if they start drinking by the age of 12, the brain finishes developing well into their 20s. So there's going to be considerable damage to their brain function and brain structure. Okay, of course it can lead to long-term consequences. And early and heavy drinking are associated with risk of adverse lifetime alcohol-related consequences. And another population that we don't talk a lot about is the children of alcoholics. If there's a parent that's an alcoholic, the child living in that environment is at a much higher risk of developing an alcohol use disorder. And the teen years are a time of a lot of changes. Here I have some pictures of how it's developmentally appropriate for the children to start, and then the onset of puberty, to start becoming more independent, to start interacting in other environments. with their peers, school, and the community. So we also need to be aware and work with all those other systems to protect youth from all those risk factors. And the social systems where teens function also have a lot to do. You know, the media. Here I have some pictures on your left. That's Miley Cyrus. So that's attractive to young girls. You know, those are the role models. We need to make sure that we're in constant conversations with them and that we educate them as how the social culture, you know, it also affects their views and their attitudes towards alcohol. And the next one is, I think, it's Snoop Dogg. And you see he's holding a drink, it has the fancy leather coat, and there's a pretty lady in the back. So those are the messages. And the other one is nectar of the guys. So they target young people, they target either males or females. It's good business. So you need to be aware of that and educate them. And why teens may choose to drink, again, they're living in these different worlds. And the onset of puberty also makes them be more willing to take risks, or they're trying to seek different sensation-seeking behaviors. And of course, they're less connected to parents and they're more independent. There are also a lot of transition periods, either from elementary to middle school, from middle school to high school. And there's relationships, heartbreaks. You know, they're more than anything trying to fit in with a crowd. So there are a higher risk of using and abusing alcohol. And what can we do to end underage drinking? It's everybody's job, and we can really work together to build a community where youth can feel good about themselves and not use alcohol. We also need everybody needs to be clear and send a message that underage drinking is not okay. 21 means 21. And a lot of the times, like other presenters said, parents feel that it's safe to allow them to drink at home because at least he's here. But we're sending mixed messages. We need to make it clear that it's illegal. They cannot support a behavior on their part that's illegal. And we also need to make sure that as parents and families stay involved with their youth activities. And of course, we can help youth learn about the dangers of alcohol, and if they have misconceptions, we can also help them learn and change their attitude about drinking and alcohol use. We know that it's, you know, it might be youth want to be in activities that involve alcohol, and we need to change that attitude. We as a community need to support youth-friendly, alcohol-free environments where the youth can go and feel good about themselves and have fun. Creating programs like volunteer work, being part of a coalition. We know that during spring break and the summer months, there are a higher risk of engaging in these types of behavior. So we also need to keep that in mind, maybe during those periods where they're not in school, make an extra effort to engage them in something that's positive. And of course, we've been doing a really good job when it comes to smoking and drugs, but for underage drinking, we also need to let them know that it's unhealthy and that it can impact their lives. And for those teenagers that are already involved with alcohol, to let them know that it's okay to ask for help. And what are some of the things that we can do to take action? And these are some of the strategies that are in the Surgeon General call to action. There are too many to really list in the next few minutes that we have. And there are some strategies that are specific to that families can implement, that schools can implement, that law enforcement can implement, as well as communities in general. So for the purpose of this meeting, I'm just going to talk to you about a little bit of what parents can do, which is to partner with other parents in their children's network, either with neighbors or their school, and to ensure that there's the social events that their children will be attending do not involve alcohol. I know there's some programs out there where parents can pledge to say, you know what, in this house you can contact me whenever your child will come and visit me, and I'll make sure that alcohol is not going to be present. And that way we can build a network of parents where you know that if they're going to their house or they're coming to yours, alcohol is not going to be present. And also collaborate with the other coalitions. We have a coalition in Webb County, we have a youth coalition, and and we have the Webcam Community Coalition. I do invite you to become part of it, to attend one of our meetings. They take place every Tuesday of the month from 12 to 1. And we have a lot of good information. You need to take action and have a voice. Sometimes it seems like it's just this group of people in this room trying to do something, and that's not the case. There's been town hall meetings taking place all across the nation. And again, it's a coordinated effort. It's not just the work of few. Also of course, to serve, like the ladies talked about, as a positive role model. It's really, change is difficult. But we need to start with ourselves, and what are the things that we can do is reanalyze, our attitudes towards alcohol. I think we need to walk the walk and see what are the things that we're doing. Are we drinking in the presence of children? Are we hosting children's parties where we're providing alcohol for the adult guests, not for the underage children? But is it necessary really to have alcohol at a birthday party or a bautizo? Not necessarily. And as communities, we can also, again, support any alcohol-free and youth-friendly programs that are out there in the community. A lot of people saying, well, there's not a lot to do in Laredo. There is. We need to find places and organizations that support alcohol-free and youth-friendly activities, and that's how we're going to get the change about. And of course, we need to work with sponsors of community events and to ensure that there's not promotion and of a culture of underage drinking. If you think of the events that we have in our community throughout the year, there's a lot of alcohol companies endorsing events or supporting fundraisers. And we're not saying not to have them, but there are other options that they can explore. And again, we need to make sure that we're very clear about the laws. It's illegal to drink under 21. And there's a parental responsibility ordinance in place that I will talk to you in the next slide. And like I said, we need to focus our attention on underage drinking the same way that we do on tobacco and illicit drugs. We need to change the culture of acceptance and saying that it's okay to a culture of disapproval of underage drinking. And we have a parental responsibility ordinance in place that pretty much says Texas law allows for you to provide alcohol for a minor, for your son or daughter, or if you're the parent or the legal guardian. However, you cannot provide alcohol to anybody else. And in this ordinance, it cannot happen in your property or any other property under your control. Even if you not knowing, let's say you have a warehouse or you have a ranch and you're allowing underage children to have a party there, and you're not present, you're still responsible. You might not even know about it, you're still responsible. And in conclusion, we just need to make sure that we talk to our children early, that we talk to them often, and that we get other people involved. Underage alcohol use remains a major public health and safety problem that creates serious consequences not only for the youth and the family, but as a community and the nation as a whole. So each of us have a very important role to play in preventing and reducing alcohol use, and it's through our individual and collective efforts. And we need to address underage drinking early, continuously, and in the context of human development. For underage drinking, use is everybody's problem, and the solution is everybody's responsibility. Thank you, and I'm going to link you there to the Church's General Call to Action. Again, it has a lot of really good information, but it's extensive, so I just covered a few of the strategies. So thank you very much.